Well, joining us now is Ido Salawu, MD CEO, Mark Press, West Africa Limited. He joins us now to talk more about, proper disposal of medical wastes at this time. Good morning, and thank you for joining us in TVC Breakfast.
Thank you. Good morning.
Now, what makes this? So we know that there is a rise in number of medical waste because of the use of gloves, masks, and the likes. But then there are concerns, and we're wondering what makes this different from other medical wastes that we see around?
No, it's not different. If you look at the class of the COVID-19, belongs to these other virus-related diseases, such as tuberculosis, Ebola, and avian influenza. All these are part of contingent viral diseases that's highly transmissible. So in waste management worldwide, there are standards put in place for managing medical waste. Then special attention are given to the medical waste coming from the contagious diseases.
Why?
Because of the high potency they contain and the ease of transmission that is involved. And COVID-19 has been given special attention even from where it originated in India, in America. The waste from isolation center and testing center should be handled carefully. Reason, and again, we are going to have a new type of waste in our dump site. This mask,
the face
mask and the hand gloves. Yeah. Problem is this: is as this face mask, if someone cough there or sneeze there, the pathogen or the virus remains here for some time. And if care is not taken, you didn't manage it very well, it gets to our dump site. The problem now is the dump site. It's supposed to be taken to a Class A landfill. What do we mean by Class A landfill? In the Class A landfill, it is well protected. The waste does not have contact with the immediate environment. So these are the landfill meant for highly contagious waste from COVID-19 and other related viral diseases. Now, if we don't, in Nigeria, we don't even have a sanitary landfill for municipal solid waste, talk less of the one that we now house or take care of the medical waste coming from our isolation center and testing center.
Yeah, that's on the state level. Now, let's bring it down, narrow it down to the individual level.
Yeah.
How should, because you just give us two things now. In fact, on traffic, we see them selling the clinical hand gloves and the face masks. But talk to us basically, for everyday person who uses this, how best should they dispose, or how can they dispose?
They call it disposable. Maybe
disposable, exactly.
Yes, after a day, you have to dispose it.
After each use?
Each use. Now, the problem now is, where do you take it to? That means these are containers that are meant for medical waste. Okay. But these are regular containers in our houses. If you look at the clip that you showed from the Epic Center in China, you see that they have the waste container outside, color-coded, different one. Each color, like the yellow one, takes waste from anatomical, surgical operation. You talk of soil bandage, you talk of human waste, you talk of waste that are very highly contagious. Fluid, the swab, everything goes into the yellow container. The red and white container, takes care of other waste, like the black one takes care of other waste like carton for medicine, discarded medicine, all this. Then this box takes care of, you can see it's really biohazard safety box. This is where you put your syringe and needle so that you don't get in contact with people and you don't infect people with that. So this one takes care of even immunization bottle, discarded bottle for immunization, the syringe, the all sharp objects goes in here. So if you manage it very well, you will not have another mode of transmission. Now, for individual from home now, we don't separate our waste.
Yeah.
Now, the risk now is for the waste manager, the waste collector that comes to your house. They may get in contact with it. But good news yesterday was Loma was trying to equip its personnel on how to protect themselves. but that is for transportation from home to the dump site.
Now,
the question now is at the dump site.
Yes.
Another thing they've done, measure they've taken, is that they've sent away all the scavengers at the dump site. That's another potential risk.
Yes.
But now, the waste itself, we don't have that infrastructure in Nigeria that will dispose this.
So what options? Limited. No options available.
The only option now is the open dump site that we have. But I think they will go further by creating a secured area that is sealed, either with clay, with HDP liner, where they will do the incineration. Because that is most of the category of waste that are coming from our proposed or from our new proposed testing center and COVID isolation center now have to be handled carefully so that they go to separate area. If not, we may have continuous cycle of this epidemic, even after the whole world have come to close to it.
Wow. All right. Wow. We have to.
Well, let me ask him one more question before we leave. The point there is, there were, in fact, we heard, just like we hear from the streets, that the kits that the frontliners wear, that
safety kit,
the safety kit, exactly. What happens to them when they finish using them?
You can see that when they are going into the epicenter, where this is what we are referring to. This one is disposable.
All right. But this hasn't been used.
No. There are some expensive ones that they use. You can see that they disinfect them before they go in. And the same attention we pay to surgical instruments that after use, you disinfect. And that's why you take them to autoclave or hydroclave. So right now, I hope the isolation center in Lagos and other areas in Nigeria will have been equipped with autoclave and hydroclave machine so that most of the kits they are going to be using there, they can be taken there, including the beddings, the bed sheets too, for where and I said COVID-19 suspect or patient will be kept. They have to change the bedding and they have to remove and even do not even laundry it with general laundry machine. So it has to be taken care so that we reduce the
a lot of work and attention has to be paid to this thing.
Salau, thank you so much for your enlightenment on this.
Thank you.
Thank you. Right.
You're watching TVC Breakfast. As the cases of coronavirus continue to spike across the world, health systems are battling the pandemic in order to flatten the curve.
Now more than ever, hospitals and even households are generating a lot of waste. The safe management of medical waste such as contaminated masks, gloves, other protective equipment is critical during this global emergency because they still have the potential to be infectious.
Managing medical-related waste is one of the essential barriers to human-to-human transmission of coronavirus in communities, homes, healthcare facilities, schools, and other public spaces. Ido Salawo, MD, CEO, Mark Press West Africa Limited, joins us now to talk to us more about how best to manage medical waste at this time. And he came with his tools, obviously. Good morning. Thank you for joining us on TVC Breakfast.
I'm very sure we'll be in class this morning.
Right now, so I'll leave it to you now to explain to us what this is.
You see this small yellow one?
Yes.
Supposed to be where you do the primary storage.
Primary storage?
Yes, of the waste. It could be inside the clinical room, and inside it is a low-density polyethylene. That's the carrier bag, the waste bag. The yellow one signifies the kind of category of waste that goes here. And we talk of anatomical waste, waste from human beings, waste that soak with blood, the swab. So you have to, in fact, for COVID, the waste now, the WHO standards say you must double those bags because of the high rate of the potency that the pathogen level that is in the virus. Now, you close the lid. It's safe somewhere. Then, when the waste collector comes, that's why at the isolation center they must be able to give lecture to those waste collectors and the health workers, because they know, the health workers, they already know that they have to secure this waste until the waste manager comes to pick it. Because it's a kind of way that we have not paid attention into. And let me give you an example. The first incident case that came from abroad, it was in the aircraft. Now, he sneezed, he coughed, he used tissue paper or serviette. And that waste now sojourned from where it comes from to Nigeria. Who picked the waste? Where does the waste goes to for disposal?
Wow.
So these are kind of things why you have to do a lot of advocacy in the medical waste management that we practice today. Things that need to be done. This particular one is for storage outside the building. It takes more, but it will take most of the waste that are coming from not surgical waste this time around. We have the pathological waste, we have the microbiological waste, we have the animal waste, we have the syringes, we have the sharp object. This one takes the sharp object because it's well protected. Because if you put needle in a polythene bag, the needle can pierce out and it can injure anybody. That's why they use this glass to take the glassware, immunization product, material, the injection. But this one takes mostly the pathological waste that are coming from the surgical room. This one is for external storage. Right. Now, my own concern now, when all these waste are now being collected from isolation center, how will they move? That is transportation and to the disposal site. First thing they need to do is to disinfect on site using chemical to reduce the pathogen level.
Who does this? Who does the disinfecting?
That is the waste manager.
Okay.
The clinic, that's the medical waste collectors. Okay. They are trained. In fact, the hospital will not allow it to go out unless they disinfected them, because it reduces. That's just one of the measures you need to take. And that's what the spray that they put on this thing is part of the chemical they use to disinfect. And once you do that, reduce the level of pathogen. Now, you now take it to a secured landfill for human waste, and that's the what we call anatomical waste. Those wastes are highly potent. First thing you need to do is to sterilize them using hydroclave. Then you now take them, you disinfect them, you now take them to incineration for incinerating. But we don't have incinerating plants in Lagos.
So what happens?
I think Naima has one, which is functioning. That's
so is that where all the waste?
Well, I will advise for now. Lagos State should partner with Nigerian Institute of Medical Research in Yaba, where their own incinerator is working, so they can carry the waste from their isolation center to that place, because they should not take it to open dump site. It is not secured and is not.
My concern now is the fact that there are some persons who do not know or do not show the symptoms, who are symptomatic to the pandemic and are wearing gloves, just, because everybody wears gloves right now, and they just dispose off anywhere. Are there measures that people can take personally to take whenever they are disposing these things?
Well,
whether you have the symptoms or not, how best to dispose it? I will advise
from home. Maybe they have this waste bag where they can safely put it there and tie it so that the level of contact will be reduced. Then the fear I have now is that the one that will be disposed in the public arena, now we're having rain coming in. Some area like India, in China, they are now finding, in Hong Kong, they are now finding nose mask and hand glove in their river. Whoa. Yes, because once it rains now, all those things will go through the public drain into the water body.
Can it contaminate the water?
No, their studies are still going on. I'm not sure that that could cause contamination to water bodies, including underground water. Even the one that we say is going to the landfill, as studies have not shown that it could contaminate the underground water. But the fear of contamination is that it could have contact with operator of the landfill or of the dump site. And that is where the risk is. For now, the human contact with the waste is as good as human-to-human contact of an infected person. So we have to be careful. The another good thing about this is that if we continuous washing of our hands, because the virus is an envelope one, that as soon as the soap or our hand sanitizer touches it, it breaking the whole system. So it will not replicate itself. So if we are constantly washing our hand, cleaning our hand with soap and water, because it could maybe disintegrate and break the virus down before it harms the next person. Okay. So those are the precautions we should take.
So washing of hands is the strongest recommendation here.
Yes, and the distance, social distance.
Social distance.
Yes.
Okay.
Yes.
All right.
We have to leave it here now. Thank you so much, Ido Salau, for joining us on the program.
Thank you.
Thank you.